Okay, picture this for a second. You've got this incredibly sharp-eyed assistant working alongside you in your practice. An assistant who, well, never gets tired, spots these tiny details we might overlook even with our best gear, and ultimately helps us do a better job preserving sight. That's kind of the promise of artificial intelligence, isn't it? And today, in this deep dive, we're really going to explore how AI is changing things in ophthalmology.
Precisely. And our aim today is pretty direct, actually. We want to show why, a practice that embraces AI, it's likely going to have real advantages over one that doesn't. We're talking about better precision, definitely more efficiency, and yeah, ultimately a bigger positive impact for your patient's vision.
Absolutely. And look, AI can sound really futuristic, maybe even a bit like sci-fi robots, right?
Mm.
But we want to keep this really grounded, practical stuff you deal with every day. So think retinal images, corneal analysis, even how it works with your slit lamp, the tools you're already using, whether you're super tech savvy or just curious about what AI can do, we think there'll be something valuable here. So maybe let's start with where AI stands right now in ophthalmology.
Okay, so right now, the key thing to understand is that AI isn't here to, take over the ophthalmologist's job. Not at all. Think of it more like,
Uh-huh.
like an exceptionally skilled colleague, someone who's just
Yeah.
really, really good at looking at images. It's a tool, fundamentally, to make your expertise even more effective.
And we're seeing real examples already, aren't we, in actual clinics, like using AI to screen retinal photos for diabetic retinopathy. And what's really striking, I think, is that these AI tools, their accuracy, it's not just getting close to human experts. Sometimes it's even matching or beating them. Can you maybe elaborate a bit on what signs it's looking for and why it's sometimes so accurate?
Yeah, that's a great point. What's really powerful is that these AI systems, they learn from enormous amounts of data, millions of images, way more than any single person could ever possibly review, you know. So they get incredibly good at spotting subtle patterns, tiny microaneurysms, exudate, maybe very early neovascularization, things that honestly the human eye might glance over or maybe dismiss as just normal variation, especially if you're tired or the image quality isn't perfect. It boils down to consistent high-level pattern recognition across just vast data sets. You mentioned Moorfields Eye Hospital. That's a perfect example. They use AI to analyze huge numbers of OCT scans, those detailed cross-sections of the retina. And this means they can spot conditions like macular degeneration much faster, often catching changes earlier when you can actually do more about it.
Right. So it's not just about handling volume, though that's huge. It seems like AI has this uncanny knack for picking up really subtle things, things that might not jump out at us, especially early on. I'm thinking about diagnosing glaucoma, for instance. We all know how tricky it can be, right? Trying to tell if it's really early glaucoma or just, an optic disc that looks a bit unusual, a large cup maybe. It's interesting. Does AI overcome some of the maybe cognitive biases or limitations we have as humans looking at these images?
That's a really insightful question. Human perception is amazing, obviously, but it can be swayed, can't it? By things like fatigue, how much experience we have, even just subconscious biases in how we interpret what we see. AI, though, it just applies its rules consistently, objectively, based purely on the patterns it learned from all that training data. So with glaucoma, for example, the algorithms can analyze tiny changes in the retinal nerve fiber layer thickness on an OCT, or very subtle shifts in the cup-to-disc ratio, the retinal rim, on a fundus photo. And it often quantifies these things in ways that our own sort of subjective assessment might not capture quite as precisely, especially in those borderline cases.
Yeah, those borderline cases are key. You mentioned a specific example earlier, didn't you? A 55-year-old patient. Their fundus photo was flagged as borderline. Can you walk us through that? How the AI picked it up as high risk for glaucoma and what happened next? Because that really illustrates the practical difference it can make.
Sure. So in that particular case, the AI algorithm had learned to recognize certain combinations of features. Individually, maybe none of them screamed glaucoma to a human observer straight away. Perhaps some very slight texture changes on the optic nerve head, or tiny variations in how the blood vessels curved as they left the disc. Subtle stuff. But the AI, having seen countless images of healthy eyes and eyes with glaucoma, it recognized a pattern suggesting early damage. So it flagged it for a closer look. And that prompted the ophthalmologist to order a visual field test. And guess what? It confirmed progressive field loss. Definitely glaucoma. Because the AI gave that early nudge, treatment started much sooner than it might have otherwise, potentially saving significant vision for that person.
Wow, that's pretty profound, actually, to think this tech, even now, is directly helping prevent vision loss in individuals. Okay, so we've seen where it's being used. Let's dig a bit deeper into how it specifically helps you, the ophthalmologist, day to day. You call AI a diagnostic powerhouse. How does that practically change the workflow in, say, a busy clinic? Where does it make the biggest difference in efficiency?
Yeah, think of it as a diagnostic powerhouse. Really gets at its ability to crunch through and make sense of loads of data from different machines. OCTs, fundus cameras, even corneal topography from slit lamps. It gives you a more comprehensive picture right up front. So, for instance, AI could look through a whole series of OCT scans, hunting for those subtle changes in retinal layers that might point to early AMD or diabetic macular edema. It flags those cases, puts them at the top of the pile for your attention. It essentially acts as a really smart first-pass filter. It helps you prioritize who needs your focused exam most urgently. Streamlines referrals, cuts down diagnostic delays.
That time-saving aspect, that sounds especially valuable for places where getting specialist appointments is tough. Like, imagine a rural clinic. A GP takes some basic eye photos. How could AI help there? I mean, it definitely helps with access, but what about the practical side? Setting up and maintaining these systems in places with fewer resources.
That's exactly where it could be a game changer. In those remote or underserved areas, AI can be like a vital link to specialist expertise.
Yeah.
A GP could use a relatively simple camera, right? And the AI software analyzes the images, looks for serious stuff like sight-threatened diabetic retinopathy or advanced glaucoma. Then the AI could give a risk score, basically saying, hey, this needs an urgent referral, or this looks okay for now. Now, implementing it, yeah, there are challenges. You need reliable internet, obviously, for updates and maybe sending data. The tools have to be user-friendly, minimal training needed for the GP, and of course, ongoing support and the cost of the systems themselves are big factors too.
Okay, so it speeds things up, helps with triage, but you also mentioned something really interesting, like some AI can explain why it reached a conclusion. You said it's like having a mentor on speed dial. Can you give an example? How does this AI mentorship actually look, and how does it help us sharpen our own skills?
Right. So some of these platforms, when they analyze an image and give you a diagnosis or a risk level, they don't just give you the answer. They'll often show you their work, so to speak. They might put outlines on the image highlighting specific things they detected. Like on a fundus photo flagged for DR, it might circle the microaneurysms or shade the areas of exudata found. So you see exactly what the AI saw. And sometimes there's text explaining the criteria it used, this visual feedback, seeing why the AI made the call. It's incredibly valuable, especially maybe if you're earlier in your career or less specialized in retinal imaging. You can compare your own read to the AI's highlighted features. It reinforces what those key signs look like and helps you get better at spotting them yourself over time.
I like that analogy, a mentor showing their work. It really reinforces that idea of AI as an empowering tool, not something taking over. But we absolutely have to stress that point you made earlier. AI isn't perfect. It's a tool. And like any tool, its output is only as good as the input, right? Garbage in, garbage out. That human expertise, our clinical judgment, that's still completely essential. AI is a powerful assistant, but it needs our oversight.
Couldn't agree more. And understanding the limits, particularly of the data the AI was trained on, is so important. If those training data sets aren't diverse, if they don't reflect the real mix of patients we see, the AI might not perform as well for certain groups, which just highlights why we constantly need to validate and monitor these systems in the real world. And, that naturally leads us to think about, well, what's next? Because this field is moving incredibly fast. We're already seeing hints of the future.
Yeah, it's pretty exciting to think about what's coming down the pipeline. Like the idea that AI could soon predict how a disease might progress for a specific patient. Imagine knowing which cataracts are likely to worsen quickly, needing intervention sooner rather than later. How would AI even do that?
Well, predicting progression is all about analyzing data over time, longitudinal data. So a series of images, measurements from the same patient collected over months or years. AI can look for subtle trends and patterns in that evolving data, patterns that might be way too complex for us to spot easily. It learns to forecast the likely path of the disease. For example, analyzing sequential OCT scans in someone with early AMD. The AI might spot specific changes in retinal thickness or how the drusen look that's statistically linked to a higher chance of progressing to the wet, vision-threatening form within, say, the next 2 years.
And beyond just predicting, you mentioned personalization, truly tailored treatments, using all that unique patient eye data to fine-tune the treatment plan. Can you paint a picture of how that might actually work?
Okay, let's imagine a patient just diagnosed with wet AMD. Instead of just starting them on the standard anti-VEGF injection schedule, maybe AI analyzes everything. Not just their current scans, but maybe genetic risk factors, how they responded to treatments before, maybe even lifestyle stuff. Based on crunching all that, the AI might suggest, Okay, for this specific patient, this particular anti-VEGF drug, or this specific injection frequency, has the highest statistical probability of giving the best visual outcome. It moves beyond a one-size-fits-all approach. You could then sit down with the patient and say, look, based on this detailed analysis, this therapy gives you, say, an 80% chance of stable vision over the next few years. Gives them much more data-driven information for their decisions.
That level of personalization, wow, that really does sound like the future of medicine, not just ophthalmology. And it's worth repeating, right? As ophthalmologists, we don't need to suddenly become coding gurus or AI engineers. The point is to understand these tools, learn how to use them effectively in our practice. So for listeners thinking, okay, this is interesting, but where do I even begin? What are some practical first steps?
Yeah, good question. There are definitely practical ways to start engaging. One is just to look into the AI screening tools that are already out there, maybe ones relevant to your patient population. You could even consider a small pilot project in your practice. Another way is to connect with research institutions or companies developing these AI tools. Sometimes there are opportunities to join studies, get hands-on experience, and like we talked about, just staying informed about the platforms that are getting regulatory approval, like IDXDR for diabetic retinopathy screening, which is FDA approved. That helps you understand what's actually validated for clinical use right now.
It really does feel like the future isn't AI versus doctors, but AI with doctors. A partnership, a synergy. And the goal ultimately is for us, working alongside AI, to be even more accurate, more available for our patients, and yeah, more confident in the care we deliver.
Absolutely. Go back to that opening idea, the super sharp assistant. Think about how the slit lamp revolutionized our ability to see the eye's structures and make judgments. AI is kind of the next big leap, isn't it? Sharpening our skills again, letting us see and understand data patterns we just couldn't grasp before.
So to kind of wrap it up for everyone listening, the main takeaway is probably this. A doctor who uses AI isn't just seeing more patients or working faster. Fundamentally, they're set up to provide better care through more precision, deeper insights, and more personalized treatment.
And when you think about our core mission saving site, enhancing vision AI really has the potential to massively boost our ability to do that for every single patient, helping us step in earlier, more effectively, and frankly, with more certainty.
It truly feels like a pivotal moment for ophthalmology. So looking forward, maybe the call to action is, let's not just wait for this AI future to happen to us. Let's be proactive. Let's explore it, understand it, and figure out how to thoughtfully bring these powerful tools into our clinics, into our patient care, starting today. Thanks for joining us for this deep dive.
And perhaps leave you with this thought to mull over. As AI becomes more integrated, this incredibly powerful analytical capability, how might it change not just how we diagnose and treat, but maybe the very dynamic, the trust, the interaction we have with our patients?
It's a really interesting crossroads of technology and the human side of medicine.